The intuitive and valued dimensions of ethical practice. The ethical framework of counseling draws from a common, inherent understanding of what constitutes morally sound action. Beyond this intuitive grasp, the profession is deeply informed by a set of core values. These core values are actively manifested in the personal virtues that characterize practitioners who are committed to upholding the highest standards of their profession. Furthermore, the moral basis of counseling is rigorously informed by established ethical principles. Here are the principles and ethical codes governing allied health and caring professions for navigating complex moral considerations. Autonomy. Recognizing the inherent right of individuals to self-determination, encompassing freedom of action and choice, provided that the exercise of these freedoms does not infringe upon the equivalent rights of others. Non-maleficence. The essential responsibility upon all helping professionals to, above all else, refrain from causing harm. Beneficence. The active intention and commitment to promote the welfare and best interests of the individuals being served. Justice. The ethical duty to ensure the fair and equitable distribution of resources and professional services, without bias or prejudice. Fidelity. The obligation to be loyal, reliable, and to act in good faith within the therapeutic relationship, fostering trust and dependability. These foundational principles serve as the bedrock upon which ethical counseling practice is built. Consequently, frameworks for understanding relational ethics have emerged, highlighting the interconnectedness of ethical conduct and the quality of the therapeutic bond. Practical application of ethical principles. In the practical application of these principles, however, the focus tends to combine a set of key domains that demand careful and consistent attention working within the law. Adherence to all relevant legal statutes and regulations that govern the practice of counseling. Negotiating informed consent, ensuring that clients have a clear understanding of the therapeutic process, their rights, and the limits of confidentiality, and that their consent is freely and knowledgeably given. Confidentiality. Maintaining the privacy of client information, with clearly defined exceptions where disclosure is legally or ethically mandated. Competence. Recognizing and operating within the boundaries of one's professional knowledge, skills, and experience, and actively seeking supervision or referral when necessary. Sensitivity to cultural differences in moral standpoint, using touch. Exercising extreme caution and adhering to ethical guidelines regarding the use of physical touch in therapy. These domains represent critical areas where the foundational ethical principles are actively applied in the daily practice of counseling. In summary, the moral basis of counseling is a multifaceted and evolving landscape. A deep understanding of these principles and their practical application is indispensable for fostering ethical and effective therapeutic relationships.